Hometown Radio, KGAF presents the Community Service Report. Here is Dee Blanton.
Hi again, everyone, and welcome to our community service program here on this Thursday, Muenster Memorial Hospital Day today. And as always, very happy to be joined by Brian Roland, the CEO at MMH. How are you?
I'm doing great and excited to be here today.
It's good to have you here. Probably quite a bit to talk about today, so I'm just going to let you lead and see if I can come up with something.
That sounds good. Hey, I do want to start with a quote by Franklin Roosevelt. He said many years ago, "In politics, nothing happens by accident. If it happens, you can bet it was planned that way." And think about how long ago he said that and what we're dealing with today.
Yeah, true.
And actually listening to your radio show earlier this morning, apparently our legislators and lawmakers in Washington have been listening to your Taylor Swift song also, because apparently they're never, ever going to get back together and figure out what's going on.
Makes you wonder, doesn't it?
It sure does. But I will tell you, I do want to tell everybody Happy Valentine's Day. This is a wonderful Thursday. Want to make sure that I tell my wife and daughter Happy Valentine's Day, all of my staff. And for the record, my favorite song was Ronnie Millsap. What a Difference You've Made in My Life was actually sung at my wedding 30 years ago next month. And I do have to remember that. So it was good to hear you guys talk about it this morning. But I tell you what, in healthcare, things are just going. Right now, if you look at what's going on with the Texas legislative folks, if you go out there and look, there's 708 bills on the record with the word health in it, and there's 130 with the word hospital in it. So what does that mean for us? Who knows?
Exactly.
There's anything from, letting hospital districts have armed police officers, to mental health issues, to Medicaid finally paying these rural hospitals the way they should be. What's going to come out of it, who really knows? And that's the interesting part with healthcare today, is when our legislative branch is doing their stuff and job, there are so many changes that can come out of Austin over the next 6 to 8 months, and then obviously the years going down, that you just kind of have to practice what you're doing now to the best you can, but try to prepare for what could come down. Because when you read through these bills, if you can handle reading them, because some of them really don't make sense, you have to figure out, could this affect me? How would this affect me? What do I put in place now so I'm prepared if it does affect me? And then what role are the regulators going to play when they're actually looking at this bill that's put into place? Whether it's mental health, there's bills out there talking about teledentistry now. Now, I'm not sure how they pulled that off, but, so there's a little bit of something for everybody. And I think that's the interesting challenge we face right now. Every day I get stuff sent to me in the email of hospitals closing, hospitals filing bankruptcy. We've really had an uptick, and part of that is because it is so hard now for rural hospitals to keep up with the legislative changes and mandates that the regulators are putting in place on a small rural hospital. 20, 30 years ago, life was simpler, healthcare was great, care was really good, and there weren't a lot of rules. Now, I'm not saying rules are a bad thing, but when you rule people to death and report, it gets to a point, how can you manage all that? And if you get penalized for not reporting, it really causes a challenge. And so it's going to be interesting with the changes, that some of this legislative stuff has brought up. Now, and there are some really good things they're working on. One of the bills that are out there that I think is really good for rural healthcare is giving nurse practitioners or advanced nurse practitioners more authority. And in a rural setting where it's hard to find a doctor, I think that is a lifesaver for some rural hospitals from a cost standpoint, from a care standpoint. And so it's interesting on a daily basis going out there and looking at the legislative stuff and figuring out what applies to me, what applies, me being Muenster Memorial Hospital, Cook County, and our region, because it definitely will affect all of us. So just going on that.
I knew the legislative session was probably going to be at the top of the agenda here to talk about today. And the thing is, we're only in mid-February. They can't even start voting on things for another month. And so there's no telling what else could be added to this list between now and then.
Well, and that is the interesting thing. I get emails from certain groups who are trying to push certain representatives to co-sponsor bills and things along those lines. So, yeah, the number can probably go up by another 35% is what I'm figuring. So even what I'm looking at today is going to be completely different than what we're looking at in the next 2 months. And then the rigmarole that they go through, and I know that's not the correct term, but, all the different branches that it has to go through and all the different committees, and then people have to go down and talk about why theirs is such a good idea and why this person's isn't. And so at the end of the day, when it all shakes out, we really don't know what's going to be out there. And are they going to benefit rural hospitals? Are they going to benefit your large tertiary hospitals like a Parkland or a Medical City group? And that's the thing. You just kind of have to sit back and let it play its course, but be thinking about what are we going to be doing to prepare for the possibilities of certain things.
Yeah, and it's all hospitals and medical facilities that are affected by all of this. And it's not just rural, but those are the ones we hear about. Those are the ones, especially the tax-supported hospitals, that are having the most trouble dealing with this, whether it be, just rule changes, unfunded mandates, whatever. You have to deal with all of that, and not knowing for 2 years in between sessions what's going to happen next it's got to make planning for the future very hard.
It is, and one of the interesting things is, and this is just kind of food for thought, is when Medicare tells you in a critical access hospital like ours that your cost to take care of a patient per day is $1,500, yet the insurance companies only pay you $300 a day. Mm-hmm. Where do you think we're going?
Yeah.
And yet when you ask the insurance companies for something, they blame it on Medicare.
Right.
And so even the inner fighting between them and now the Medicare Advantage plans, who are kind of stuck in the middle because you get a decent reimbursement, but you get no benefit on your cost report. You actually take a hit on your cost report, and those in Cook County have gone up 19 to 27% in the last 4 years. So it's just been a really, really interesting time, and I think as we continue to go, it's going to continue to really be a challenge. And you really have to look at all the different phases. You have to look at expense management. You have to look at cost containment. You have to look at what services do we really want and need in our community with the other hospitals that are around us.
Yeah. It is a very difficult balancing act. There's no doubt about that. And again, although we hear more about the small rural hospitals suffering and closing, don't think it's always mismanagement. Many times it is actually the R's and R's that put down the hospital more than the management, because the best managers in the world sometimes can't handle what they're told to do.
That is correct. That is correct. Yes.
So it is a very, very tough situation. Well, by the next time we talk, Brian, no doubt we'll have some better idea. A little bit of it will be sorted out by then, and we'll see where we stand. The number of bills may be 3 times what it is right now.
And it could be, because nowadays they're putting them in there for anything and everything.
Yeah. So, and there's always a little pork barrel stuff in there too, which doesn't help.
That's correct.
All right. Brian, thank you very much. Appreciate it. It's always a pleasure to talk to you.
Definitely.
All right, there he goes. He is Brian Roland. He is the CEO at Muenster Memorial Hospital, and that's going to wrap it up for our program here on Hometown Radio, KGAF.